Good afternoon and good morning. This is the 1959th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Anita N. Chawla. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of well-wishers of homeopathy, homeopathic students and doctors, and we have 3 sessions every day. For the first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English, and from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who missed the session can watch it again. You can subscribe the same without paying any money. Let me come to today's guest. Our guest is Dr. Anita Chawla. She is the first MD holder from Nausik, and she is a consultant physician, counselor, skill trainer, studies motivator, and she is a physician at Abhinav Clinic, Chintamani Park, Gangapur Road, and Nausik. And she is the winner of many awards, and she was awarded the second prize in the short paper oral presentation on the 6th Homeopathic Vijnan Summit organized by GHF and Vijnan Bharati Vidyapith in 2024, and she was awarded the Beacon Foundation Contest Mumbai held in February 25 and awarded Beacon Foundation Quiz Competition Award held in 2018, and she has published a book named History of Medicine and Homeopathy. She has more than 25 years of clinical practice and including 2 years services at Heart Hospital. And doctor will be talking about homeopathy in PCOD, a very, very important subject. As you all know, nowadays, lot of young generation ladies suffer from this particular problem. So we have a solution to it, but unfortunately, people are not aware about this scope of homeopathy in PCOD. So it is high time to take this into the public, and the purpose of the forum is that. So we are inviting the guest of the day, Dr. Anita Chawla, to take this session. We welcome Doctor.
Thank you, sir. Thank you. Thank you. Thank you. Shall I share my PPT?
Yes, you are the co-host now. You can do it.
Yeah. So sharing is not done now. Hello.
Yes, now you can. Now you can. Now you are the co-host. Please check Anita Chawla. Someone is just talk to. You have started sharing. Yes, it is all. Or it is there. We can be. It is visible. I can see. Everybody can see. Can you hear me?
Yes, sir. I can hear you.
Okay, you can go ahead. You. Everything is fine. You can go ahead.
Okay. Thank you, sir. Thank you, IFPH team, for giving me opportunity to talk on this subject, PCOD. My topic is homeopathy in PCOD. This project is dedicated to my parents. In brief about PCOD, menstrual cycle, PCOS. Menstrual cycle is normal menstrual cycle is the monthly series of hormonal and biological changes in female reproductive system that prepares the body for potential pregnancy. Here, 3 steps are involved. First, the release of an egg from an ovary, which is called ovulation. Second involvement is thickening of uterus lining. Third one is If pregnancy doesn't occur, the shedding of this lining through menstruation. The cycle is around 28 days, though length can vary from 21 days to 35 days for healthy cycle. Now, in short about PCOD, that means polycystic ovarian disease, is mostly caused due to hormonal imbalances and genetic tendencies. In normal menstrual cycle, the two ovaries will release mature and ready to be fertilized egg each month alternately. However, in PCOD, the two ovaries will not release mature eggs. These mature eggs develop into the cyst. This leads to menstrual abnormalities and hormonal changes. If we don't treat such type of cases, patient will develop symptoms like hair loss, male type pattern hair loss, weight gain, infertility, and later on patient may get type 2 diabetes, mellitus, heart diseases, many more problems. Now these days PCOD has become burning issue all over the world. Study shows that ladies with family history of polycystic ovaries are half bound to PCOS to create PCOS. PCOS. PCOS is complex metabolic. Here all axes are involved. PCOS is complex metabolic, endocrine, reproductive, psychological disorder that impacts the quality of life of female of reproductive age. PCOS is also called Steele-Leventhal syndrome because it was first time described by Steele-Leventhal in 1935. Polycystic means many cysts. Pathophysiology of normal menstrual cycle. In normal pathophysiological functioning driven by HPO axis, that means hypothalamic pituitary ovarian, and this leads to hormonal fluctuation that prepare the body for pregnancy. In hypothalamus, there is release of gonadotropin releasing hormone which stimulates the pituitary glands. In pituitary gland, follicular stimulating hormone and luteinizing hormones are released. In ovaries, follicular stimulating hormone, luteinizing hormones act on the ovaries to promote development of ovarian follicles, which leads to production of estrogen and progesterone. These two hormones are produced. These hormones prepare the uterus for implantation. That means for pregnancy. And in the absence of pregnancy, this leads to endometrial shedding, that is called menstruation, and cycle is restarted. In other words, the menstrual cycle is finally orchestral series of hormonal events involving the HPO axis, that means hypothalamus, pituitary, and ovaries. Here, phases of menstrual cycle, two phases are involved. First phase is for follicular phase and second phase is luteinizing hormones. In follicular phase, two events occur in ovaries and endometrium. In ovaries, FHS stimulates the growth of several ovarian follicles. Here, only one dominant follicle is matured. Not all ovarian molecules are not ovarian follicles are matured. Only one dominant follicle is matured. In endometrial event, the proliferating endometrium thickens due to rising estrogen level, preparing for potential implantation. In luteinizing phase, two events occur at ovarian level, at endometrial level. In ovarian level, LH is triggers to ovulation and releases the egg from the dominant follicle. The ruptured follicle then forms a corpus luteum, which produces high level of progesterone and estrogen, which supports the endometrium. In endometrial event, the endometrium undergo further changes to secretory stage, making it receptive to fertilize egg. If pregnancy does not occur, the corpus luteum degenerates. It causes a rapid decline in estrogen progesterone level. This estrogen progesterone withdrawal leads to constriction of the blood vessel in the upper two-thirds of endometrium. causing it to break down and be shed. The shedding of endometrial lining is called menstruation, making the end of this cycle and beginning of new follicular phase. Pathophysiology of PCOD and PCOS. In PCOD, PCOS, multiple follicles begin to mature, not one. Actually, follicles should mature only one, but here multiple follicles begin to mature, but a dominant one fails to be selected, leading to formation of small cysts on the ovaries. The pathophysiology involves a lack of appropriate hormonal signals needed for dominant follicles to mature and release an egg, which leads to irregular or absence menstruation. Disruption in HPO axis, that means hypothalamus pituitary ovarian axis, leads to irregular gonadal releasing hormones, and which leads to elevation of luteinizing hormones, and this luteinizing hormone stimulates the ovarian stroma and theca cells to produce excess androgen and disturbing follicular maturation and inhibiting the dominant follicular formation. Small follicles in the ovaries continues to secrete estradiol at similar level to those observed in the early follicular phase. Androstenedione is converted to estrone in peripheral tissues, leading to elevated estrone level. Persistent estrone secretion and elevated estradiol leads to the production of luteinizing hormones. Increased luteinizing hormone secretion and sustaining high levels of HCl without cyclical fluctuation leads to the anevolution. Elevated estrogen level suppresses the FSH secretion, resulting in relatively low FSH level. High level of LH further stimulate the ovarian androgen secretion, and prolonged low FHS level prevent the development of dominant follicles. This secretes this creates a detrimental cycle characterized by elevated androgen levels and persistent anovulation, which leads to polycystic ovarian alteration. Here, if you see, FHS level will be decreased and LHS level will be increased. That's why anovulation occur and there is a formation of polycystic ovaries. These 2 points are very important: low FHS level and high level of LH hormone. Need of the study. In India, nearly 40% women are affected by PCOD. Many women with PCOD demonstrate obesity, acne, hirsutism, hair loss, excessive unwanted hair. Few studies are conducted to regularize menstrual cycle in PCOS, but studies on effect of homeopathic medicine on polycystic ovaries are very rare. Keeping in mind the above views, the present study was conducted to see role of homeopathic medicine to regularize menstrual cycle and on polycystic ovaries in PCOD and PCOS. Case number 1. A 18 years old girl had delayed menses since 1 year. Details of her presenting complaints. She had come on 11th October 2015. She was in 12th class and she had come along with her maternal auntie. Delayed menses since one year. Menarche was occurred at 11 years when she was 13 years old. LMP 27 July 2015. Cycle of menses 2-3 days flow. Her cycle was 45 to 60 days, but this time menses was more delayed. Flow was late, scanty, dark red, sticky. Earlier menses used to come in time, but it was scanty, dark red, dark red. Past history: she had suffered from measles when she was 10 years old. Her personal history: no desires and aversion, but not specific desire and aversion. Thirst: she takes approximately 2 to 2.5 liter water. Menses late, scanty, dark and sticky. Thermally, she is hot. Build was medium. About her nature: she was short tempered, cannot tolerate contradiction. She used to get full marks in maths, but one day one day 1.5 years ago, she was failed in maths, and that time her sir said angrily that you cannot pass in maths. And by hearing this, she was disappointed, and she developed negative feelings about the study. Since then, she got less marks in exams and gets very low marks in maths. Constantly, she was thinks about marks. She used to like to do some activities, but since a few months, she does not like them. She likes traveling. She likes dance, singing, and singing songs. Her sonography shows both ovaries reveal increased centroechogenic and small peripheral arranged follicles, which suggest the polycystic ovaries. This is the sonography films. These are the films. A report shows polycystic ovaries. Diagnosis polycystic ovarian disease. DDF remedies. These medicines were close coming. Graphitis, Macab, Nuxmos, Natrum pulsatilla. But the totality of the symptoms of the patient is very similar to lachesis. So lachesis was given for following indication: short temper, cannot tolerate contradiction. A girl is to love to do in activities, but now for a couple of months she doesn't like it. Elements from frequent disappointments as she gets lower marks in examination. Amusement desire. Her menses were late, short, scanty, dark red, sticky. She was hot. Lachesis 30 was given 3 times a day for 2 days, then followed by SL follow-ups. 12th November 2015, menses did not appear. So again, lachesis was repeated 3 times a day for 2 days. Follow-up on 26th November 2015, menses came on 5th day. LMP 17th November 2015, as period came. So SL was given. 22nd February 2016, menses were regular but flow did not improve. So again, lachesis 30 was repeated 3 times in a day for 2 days, followed by SL. Follow-up on 26th December 2016, menses did not appear since 1.5 months. Earlier menses were regular with good flow. LMP 3rd November 2016, repeated lachesis 3 times a day for 2 days, followed by SL. Again, follow was taken on 4th January 2017. Menses did not appear after repetition of lachesis. So again, lachesis 30 was given 3 times for 3 days. Instead of 2 days, 3 days, lachesis was given. Here, doses of lachesis were increased. 1st February 2017, menses did not appear after taking increasing doses of lachesis. So potency of lachesis was increased. Lachesis was given to 200 potency 3 times in a day. Menses came on 8th February 2017. From 8th February 2017 to 5 July 2018, menses were normal with good flow. 12 October 2018, menses did not appear since 3 months after repetition and increased doses of lachesis 200. The patient did not respond. So again, potency of lachesis was increased to 1 m. Menses came on 14 October 2018. From 14 October 2018 to 21 October 2019, SL was given 2 times in a day. As menses appeared every month and flow was good. Again, sonography was done and it showed normal USG. It showed normal USG. Results after homeopathic treatment. Menses appeared in time with good flow, and USG finding showed polycystic changes in ovaries resolved almost completely. That means there was no polycystic changes. These are the films of sonography. These are the films. And this is removed. This is a report. There is no polycystic changes. This is before and after after treatment, before and after treatment of homeopathic medicine. These are the reports. Case number 2. The 23-year-old girl had delayed menses since 3 years. Her presenting complaint, she had come on 10th May 2023 with the following complaints. Menses delayed menses 3 years. Menarche appeared when she was 14 years old. LMP 17 February 2013. Cycle 2-3 days by 60 days. This time menses were more late. Menses were late, scanty, dark red, sticky. Earlier she used to get menses for 2-3 days, and cycle was 30 to 35 days. She also used to get throbbing headache after exposure to sun, better by rest. She had suffered from chicken pox when she was 11 years old. Personal history, no specific desire and aversion. She takes approximately 3 liters water. Menses late, scanty, dark red, sticky. Thermally, she is hot, lean, thin, oily face and hair. About her nature, she is short-tempered, irritable on slightest matter, cannot tolerate contradiction, brooding for longer period, and which affects to her works. She is also sensitive to noise. Her sonography was done on 12th May 2023, and it showed both ovaries show peripherally arranged tiny follicles, which suggests polycystic ovaries. This is the report. This is report, and she was diagnosed as polycystic ovarian disease. And Natramur was given because of following indication: short-tempered, irritable on slightest matter, cannot tolerate contradiction, brooding for longer period, which affects her work. She is also sensitive to noise. She gets throbbing headache. Her face is oily, even hairs are oily. She is hot patient. Her menses were late, scanty, dark red. Netramur was given 3 times in a day for 2 days, followed by SL. Follow-up was taken on 24th May 2030. Menses appeared, but flow was not improved. Her LMP was 18 May 2023. Menses were very scanty, dark red, sticky. So Netramur 30 was repeated 3 times in a day for 2 days. Follow-up on 3rd October 2023. Menses did not appear for 2 months. Her LMP was 29th July 2023. So Netramur 30 was repeated 3 times a day for 3 days. 16 October 2023. Menses did not appear after repeating Netramur 30 in increased doses. So Netramur was given 200 3 times a day for 2 days. 12th April 2024. Menses did not appear since 2.5 months. Her LMP was 27 July 2024. So again Netramur 200 was repeated for 2 days. 29 April 2024. Menses appeared with good flow. Her LMP was 19 April 2024. So SL was given 29 April to 24 to 29 October 2024. Seclec was given. Later on, she stopped medicine as flow was good and message used to come in time. On 13 August 2024, again USG was done. It shows there is considerable regression in size, volume, and polycystic changes in ovaries. Results after taking homeopathic treatment: menses appear regularly with good flow, and USG finding considerable regression in size, volume, and polycystic changes in ovaries. This is sonography reports which shows regression in polycystic changes. This is a report before and after taking up homeopathic medicine. Learning from these cases, very promising results were obtained in PCOS, such as regularization of menstrual cycle and regression of polycystic ovarian changes. For this, to conclude this point, we need to study more for a longer period. Conclusion: homeopathic medicines are effective in regularization of menstrual cycle in PCOD and PCOS. Homeopathic medicines are also effective to regress polycystic ovarian changes to ovarian changes in PCOD and PCOS. Thank you. Thank you. Thank you. Hello. Hello.
Yes, doctor, it was really a very good session. Even though we were have presented two cases, both cases were excellent. I hope that we can have some more cases if you have, or do you have some more cases to present, or just only half the time is over? We have more than 34 minutes remaining. Otherwise, we can go for discussion.
Bring a few more cases. Just give me 2 minutes to share.
Yes, yes. As we all know that the PCOD, which may usually affect in the younger age, particularly nowadays, the lifestyle of each and every person is different, and most of the children has to go from home to school without walking. They may just coming out from the room, and they may enter into the vehicle, and then they reach the school. Then they have to sit in the class, and they have no time to play, no time to exercise. They have not exposure to it, and that is one of the reason why the lifestyle problem, it is one of the lifestyle problem, I must say. And not only that, most of the food habit is also very, very important here. Most people take food in a different way, and they visit to hotels or for lunch, breakfast, or lunch, or even most of the people used to take the dinner outside home at night, and that too in late. So they may take a lot of a non-vegetarian diet, or heavy diet, because while sitting with the family, and people used to take a lot of different type of food. So the size of the body is increasing in a large way, and since they are taking a lot of chicken, and they are also making this problem, because they are having full of hormones, and because of that hormonal changes, sometimes a patient may get into this kind of PCOD. And as we know, PCOD sometimes people even before reaching the age of 10, they may develop PCOD. As a result, they don't know actually in that age, the children may not be able to differentiate, whoa, why this blood is coming from this part. They may having fright on that, and they may be ashamed of being insulted during the classroom, or sometimes in the outside when they were in the class, or the blood is rushing out from their body just like anything. They same way they may used to cry. We need to educate people, students, even from the seventh age, I think, because that much of advancing, the menstrual cycle has been, the menarche has begun. Even though we used to say that it may begin at 11 or 12 or 13, but things are different now. It may happen before the age of 10. So once it happens, they may be frightened, and thereafter the fright in the body, that may develop an anxiety, and that may be one of the reason for this PCOD.
Yes,
And
sir.
are you ready for the presentation? Some more cases?
Yes, sir. 1 minute, sir.
Yes, 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 yes. Otherwise, there may be a gap. That's why I'm talking. And if you are ready, then we can go in that way. We used to get so many cases, but we need different approach in all cases. But particularly as a homeopath, we have to take the constitution of this case and how they are active, whether the child is active or whether the child is simply sitting in the home, whether she is interested in all activities, what kind of food she used to take, and how she interact with the family members. Nowadays, most people are also sitting and watching YouTube channels, even sex films also. So they may not be able to understand how it happens, when it happens, why this happens, and how it can be solved. Sometimes it may be the parents may not have much time to talk to these children, and that also may be a reason. And sometimes these children may be used by some people in the home or somebody outside for the sexual purpose, and they even they don't know what it is, and that also makes some kind of fright in the mind of the person, and as a result, that may also become a big reason for all these things. Uh, and this is what I would like to add to the session. And are you ready now?
1 minute, sir. Just a minute.
So what we need to give is that let them have regular exercise. So most people wake up very late and they even don't have the breakfast in time. So for that, at least the students should wake up at least 2 hours before they were about to leave the home for the schooling. So that's one of the important thing. They need to take breakfast without any break, and that is also very important. They need to take a lot of vegetables, fruits, as well as a little bit of exercise in the morning, and even in the night also they need to take supper as early as possible, at least before 8 p.m. And they should have at least 6 to 8 hours of sleep in those ages. But particularly when the child is before 15, they need at least 8 8 hours of sleep. And if the child is for above 15 years, then they may require at least 6 hours of sleep. That's enough for the student to get fresh in the morning.
My
So,
slide is visible.
I yes, your slides are visible, and now you can go ahead.
The case number 3. Now, these are the very small short cases I have presented. Uh, 15 years old girl had delayed menses since 1 year. She was given pulsatilla for following indication. Her nature are mild. She likes company, emotional, thrustless, likes cold things. She was hot. Menses were late, scanty, dark red. After giving homeopathic medicine, her menses appeared regularly with good flow. USG findings showed considerable regression in size, volume, and polycystic ovarian changes in ovaries. These are her reports. Fourth case is 24 years old girl had delayed menses since 3 years. I think this case I have presented most probably. No, this one is not. No, okay. Uh, hmm. So she was given Natramur because of following reason. She was short temper, irritable on slightest matter, and uh, sh- she used to get throbbing headache. She was sensitive. Her USG finding showed. I think this case I have presented. This one. Her USG finding 23-24. Case number 15. A 34 years old female had delayed menstrual cycle since 10 to 12 years. Her testosterone were raised to 86 nanogram and insulin was raised to 26.8 ml UN, and her LH was 9.1. She was given MECAP because she was short tempered, sensitive to noise, desires mate. severe acidity, sore water brush. She used to get constipation. Menses were delayed for 2 3 months, and it was scanty and dark red. After giving homeopathic medicine, her menses appeared every 1.5 months to 2 months. Earlier, she used to get every 2 3 months. Now, little bit improved, and her sonography didn't show any improvement. So what I have seen in my project, that whenever male hormones or testosterone increases, or also insulin level increases, so we usually get results very late. So her case was taken on 5th October 23, and again sonography was done on 14 December 24. In this 1 year, we couldn't see sonographical changes, but improvement was seen. So what message I want to give, whenever PCOD is seen in sonography, girls needs to take, a person needs to take medicine in time, so that there will not be further hormonal changes like testosterone, insulin. And if testosterone and insulin changes are raised, then we get result very rare. Along with, when there is changes in follicular stimulating hormone, whenever there is a increased ratio between follicular stimulating hormone and luteinizing hormone, there also we do not get results very fast. So we need to take medicine as early as possible. So these are the my 5 cases. These are the my 5 cases.
Okay,
Thank you,
okay, thank you.
sir.
Thank you. Oh, okay. Anyway, both cases, even though the cases were short, we got all the results. How much time you get, you need require in these cases to get recovery?
Mainly, sir, mostly I repeat sonography every 1 year.
What are the kind of what are the kind of advices you use to give to the patient, your patients?
I actually advise for exercise also, and diet also, and I say at least to walk for 2 3 kilometers daily, and
Uh,
restrict carbo diet, and but to change lifestyle changes. She needs to take. Huh.
what kind of importance you give to stress in PCOD?
Along with
Because
medicine, she needs to change her lifestyle also. Because I have seen many girls, and these
well,
days don't do physical exercise. They are sitting on
yes,
one place having fast food. So these are the
because yes, because of the teenage, they may have some love affair, or sometimes that may disturb the thoughts of the girls in that time. I have an impression because sometimes they may have to hide these things from the students, classmates, and even from family members, and because of suppressing their desire to, when they are not even expressing things to others, naturally that may result in mental agony, and it may be one of the cause for this PCOD. Do you think it is right or not? What's your
yes,
approach?
yes, sir. These are also important. I have seen these findings also. These
Yes,
findings.
yes, these are the things as a homeopath we need to look into. These kind of things. The etiology can be of this variety, and sometimes not only in the the in the pathological aspect of each and every case, we have to give more important to this kind of things. Am I right?
Yes, sir.
Yes, it is a time for discussion, and those who want to participate in discussion may please raise your hand so that somebody AMS level is 12. Also, prolactin is high. PC. Somebody is
So
written.
AMH and this prolactin hormones increases, but these are the not diagnostic criteria, because this study is done. First 3 points should be present. One is the sonographical changes and abnormality in sonography. And second thing, changes in FHS and LH level. These are the diagnostic criteria to PCOD. This is recent studies which I have seen. And the prolactin hormone and AMH hormones also increases, but these are not diagnostic criteria.
Okay. If anyone want to talk, please raise your hand so that we will allow you to unmute yourself.
Mostly I
Ambadi.
use LM potency. I use centesimal scale mostly. And I found good results in
Ambadi, yes. Ambadi doctor, can you speak for a while? And Dr. Jolie, she's, yes. Please unmute you. If you are able to speak, you can speak
Okay, can you
your
hear me?
experience. Yes, yes, yes. Yes, yes, we can.
The presentation was very nice. Thank you a lot. See, you have narrated so many points. Thank you a lot.
You are out of home, I think. Yes, Dr. Jolie, can you speak? Can you share some of your experience here?
hello friends, you can share your cases also, so we can also learn from you also.
Yes, we have another person, very important person, Dr. Shanda Chandran. I am inviting Dr. Shanda Chandran to say few words on the presentation as well as some of your cases here. Sridharakur sir, can you say a few words on PCOD from your experience?
Yes, whether it is audible?
Yes, sir, audible.
Yes, there was a few cases I am very successful. And that it takes so much time, and that it may take that much time. Especially, I got result with Tuja and Medornum, such medicines. One case about 1 year back, about one lady from Delhi. She was suffering from this PCOD. It was treated with allopathy, Ayurveda, and some few homeopaths from Delhi also, but it couldn't get any relief. Last then I repetized, I got few medicine. Within that I selected Tuja and gave first Tuja, then and the intercurrent I gave Medorna. Last it is improved about 90%. After getting 90%, she discontinued the treatment. Like that, few more cases I got, but not. I am not my experience. I got very few cases only. Every year getting 1 or 2 or 3. Not like that. All other cases I couldn't get. Anyway, it is a good scope for the homeopaths to treat such cases. The other systems may not able to give this much result. Even if you may give, even it is not 100% cure, we are able to give good result. That is my experience. Thank you very much for inviting me for that. I have not heard that her. Anyway, what I heard, that is her, this presentation was good. Thank you very much. Come again. Thank you very much for calling me. Because I'm not heard completely. That is why I'm not able to say that much. Okay.
Yes, sir. Yes, sir. Yes, sir. Thank you very much for sharing your case here. And now there's a question in the chat box from Dr. Sudhi. Ma'am, please send about the mother tincture role in PCOD. Have you experienced any mother? Have you ever used mother tincture in the treatment of PCOD, Dr. Anita Chawla?
I mostly do classical homeopathy. I mostly don't use mother tincture. I do my practice classical where I give individual medicine. And some
Okay, yes. Okay.
some
Dr. Sheila want to ask something to you. Okay, Dr. Sheila, please unmute yourself.
Hello, ma'am. Very good evening, ma'am. And your narration was very good. And I have one doubt, ma'am. What are the investigations we have to do for this, ma'am? Except this USG blood test, which one we have to do for this one?
testosterone, insulin levels are important, and mainly what is the FHS and LH ratio. If it is more than 1, then you can diagnose it is a PCOD case. In some cases, we find level increase to 2 ratios. FHS LH ratio is very important.
Okay, ma'am. And one more question. For you already told you are first given 30th, then 200, then higher potencies. When
Yeah.
compared to these two lower to higher, LM potency or these lower potencies are more. Yeah, which is
I couldn't get your question.
yeah. You already narrated 3 more cases. In this, first you started with 30, then 200, then higher potencies. I am asking whether this lower potency or higher potency you are means LM potency you are getting more result or from the lower potency, ma'am.
I have not used mostly LM potency. I use 30, 200, 1M potency. And centesimal scale I mostly use.
Okay, ma'am. Thank you so much, ma'am.
Okay.
Dr.
Dr.
Ganesh?
Sheila, yes,
Yes.
Dr. Sheila, there is a big presentation by Dr. Chanda Chandran about the test to be undertaken for female this kind of problems. If you search at YouTube presentation from Dr. Chanda Chandran, you can get it because
Okay.
there was a one-day session about that.
Okay, sir.
So
Okay,
please
thank
go
you so
through.
much.
Yes, a lot of videos were uploaded in YouTube. Everybody need to look into that because
Okay.
not only you just look into that, you just give a like on that and you just share it with a friend so that homeopathy will reach to more people. You can
Okay.
share our videos not only in homeopathy group but also in other groups so that the purpose of this forum is to take homeopathy to every home around the world so that people need to be get awareness about the scope of homeopathy in the field of different kind of diseases, particularly female diseases, this PCOD, infertility, and all those things. And now, yes, and now I am inviting Dr. Jolie. Please unmute.
Okay, unmuted.
Okay.
Okay. That Natramure case was excellent, and that mind-based selection, as usual in our precision, is very effective. And the madam told that the case of Natramure. So some doctors told whether we are using any tincture. It is Epium graveolum. If symptoms indicated, Epium graveolum is a very good medicine where amenorrhea in PCOS. You can give Bovista tincture, Epium graveolum. Otherwise, Avena sativa is also a very good medicine because it stimulates brain, because hypothalamus, pituitary, and ovary. So the stimulation to brain. So some doctors recommended brain 3x if in obstinate cases of PCOS, brain 3x. Here, as Dr. Danesh told, that young girls has to be counseled, and whatever that Dr. Danesh told in the school and in the family, that suppression, we have to remove and make them free. Then only the brain will be free. And the diet also, we have to insist and not to take such foods because it is insulin resistant. That person is going to diabetic. That is the great that the main problem. So we should give them or teach them or inform them that if you lead such an metabolic disorder life with metabolic disorder, it will go to the insulin resistant diabetes or that it is the first step PCOD. That is the great main point as Dr. Danesh told. So he consider each and every girl as a, we have to educate them how to live. Thank you, sir.
Yes, exactly. That's what we require. We need to take every person as a different entity, and we will have to look into the reason behind of this problem. Not only but the thing is that most people think about the hormone level and everything. But once your mind is disturbed, your hormone level will be disturbed, and as a result, these things can happen. So, not simply correcting the hormones, but you have to correct the mind. Then the brain, when the brain is free, then mind is free, then your hormones will work wonderfully and the result will come as early as possible. That's why the when you the individuality, that's the reason why we used to say treat the patient, not the disease. That the individuality of the person is more important than the disease itself. So just don't think about the disease itself, but you just think beyond that, and that will make you that make the recovery as in the shortest possible time. That is what we have to do in each and every case. And if anybody want to have a question, there are a lot of expert doctors in this panel. They are even ready to share their experience. They are willing to share their knowledge also. You can ask any question about these female complaints in this point. We need to give special counseling to each and every student, and not only the children, but also the parents, because parents are very much critical about their children. They may used to give harsh kind of treatment to some of their children because when they are not getting proper mark, they may used to force them. They may even insult them in front of others. Or why you are not getting this much of your friend has got that much of what you have lost the rank this time, like that. So this kind of insult may result in, as you all know, the ailments after insult that may you can think about ignitia. Then ailments after long continued grief. Then you can think of natrum or even. But in most of the cases, we can see Pulsatla has a wonderful role to play in the treatment of this infertility. In most number of cases, I have seen that Pulsatla works beautifully because the changeability, the most important point in Pulsatla is they are mild, gentle, and also they are disposed to criticism. They may be as good as anyone in the family, but they may start crying, and when they are not crying properly, then the pulse have to cry, then you have to cry, and then when there is a situation to laugh, you have to laugh. Then another situation where you have to smile, then if you are able to smile, then that is pulsatla. The changeability from one part to the other, one kind of mind activity to the other, that is also very, very important. So if you get when a patient come into the clinic and the child, particularly the girl, is sitting in front of you, and she may be looking first like a frightened girl, then she may start laughing, then may she start smiling, and then may she start laughing also whenever we give some bits or something like that. So then that can be pulsatilla. But when there is a child coming over there, and when she is not able to talk in front of others, and she is just looking so grim like anything, and when you started to console her for something, then she may not weep, but after some time you can see the eye watering from the eyes, and that kind of thing maybe that kind of person may be nature more. So don't concern about that. So almost all melancholy's remedies are coming. That is pulsatilla, sepia, this ignitia, then mm, uh, almost all melancholic remedies can be used for treating the infertility cases, not only infertility but also the PCOD cases. So also we can use Yepis if it is on the right side. If it is on the left side, we can think of lacasis, then this natromore, phosphorus, and even if it is of a different variety, then if it is on the right side also, it is a flabby one, then we can think of calica. All these medicines are coming to the picture to treat these PCOD cases. And of course, calcarea carb is a wonderful remedy for all these things because the constitution may be looking like calcarea, but if not only the physical constitution, but the mental constitution also need to be calcarea. Even you give a medicine to a person. Calcarea force. Anyway, calcarea carb, calcarea force, and calcarea floor. These are the three remedies that in 3x or 6x potency can work wonderfully in all these kind of things, as well as you can use testis 3x or ovary. When there is a lot of hair growth in the face, you can use testis 3x. And at times you can use ovary 3x, and all these things need to be studied properly to before you administer each and every medicine to the patient. Anyway, it is the time to wind up the session. I am inviting, if anybody has any question or anything like that, just one more minute remaining. No. So I am inviting Dr. Sheila to say what are thanks to the session.
Hello, sir. Good evening, everyone. It's my privilege to deliver a vote of thanks on behalf of IFPH. First of all, I am thankful to the IFPH team for giving an opportunity to utilize this platform for the daily webinar conducted by homeopathic legends all over India and from abroad also, sir. And it was a great day with you, dear Dr. Anita Chawla. You narrated the subject very well, and I extend my heartfelt gratitude to our chief guest, Dr. Anita Chawla.
Thank you, ma'am. Thank you.
It's really motivated us. And finally, thank you all who have participated in the webinar. Once again, thanks a lot and good night.
Thank you, ma'am. Thank you, sir, for giving me opportunity. Thank you.
Thank you, Dr. Sheila, for coming over here and delivering a vote of thanks to this session. And thank you, Dr. Anita Chawla, and those who attend the session, as well as Dr. Jolie, Dr. Devi Ambadi, and all Dr. Sridhar sir to add something to the session. Hope all of you will join tomorrow's session at the same time. Thank you. Good night.
Thank you. Good night, sir. Good night, all.
Okay, thank you. Good night. It's over to Dr.